Welcome, nurse managers! This presentation will provide information on the purpose, goals, findings, and recommended actions of the study, roles, stressors, and coping strategies of nurse managers by Dr. Sonia Udod, Dr. Greta Cummings, and Dr. Dean Kerr. Current nurse managers face time constraints and experience too much work stress in too little time. Nurse managers have assumed a more critical role in managing challenging healthcare workplaces and workforce issues. For example, 67% of nurse managers report the highest level of job stress among healthcare providers. The nurse manager role has become more complex and has expanded to include the supervision of staff across multiple areas. Their workday has been reorganized to downplay the clinical practice role in favor of new managerial practices associated with productivity and efficiency. Lastly, nurse manager retention has become a major issue confronting healthcare systems. It is estimated that Canada will be short 60,000 nurses in the year 2022. An unattractive option for potential and future Canadian nurse managers exists, with high turnover rates, financial constraints, focus on efficiency and productivity, and a risk for mental health illness due to workload issues. Now let's move on and talk about the purpose, goals, findings, and recommended actions of the study. The study's project summary involves minimizing nurse manager role stress and enhancing coping behaviors consistent with engaging and retaining nurse managers, while being cost-effective to the organization, as well as improving job satisfaction vital to sustaining nursing leadership. Goals of the study include identifying workplace stressors and coping strategies, generating evidence to facilitate healthy work environments, and influencing nurse manager retention. Participants included nurse managers from 16 different locations in Saskatchewan and Alberta, aged 26 to 61 and above years of age. Their nursing experience ranged from months to over 35 years, whereas their nurse manager experience ranged from months to 25 years. Their education included diploma, degree, and master's. A total of 6 role stressors were identified. They include working with limited resources, responding to organizational change, senior management's disconnection, being pulled in different directions, adhering to regulations and standards, and putting out fires. The first major stressor, working with limited resources, refers to the time and financial constraints and stretched human resources in the day-to-day operation of managing a patient care unit for safe, quality patient care. This stressor is a result of a constrained budget as well as limited staff and time. This stressor was mentioned by 91% of participants. The second major stressor, responding to organizational change, refers to a continual flow of initiatives and priorities that influence the operation of the unit with the aim of improving the delivery of care. This stressor was mentioned by 88% of participants. The third major stressor, senior management's disconnection, is a perceived lack of understanding and support by superiors regarding the reality of work environments and the extent to which managers can foster and/or influence change in the workplace. This specific stressor is a result of a lack of understanding and support, which results into an evolving role with unrealistic expectations. It was mentioned by 91% of participants. The fourth major stressor, being pulled in different directions, refers to the number and intensity of competing organizational and patient demands and priorities, and how participants struggled with the psychological demands related to administrative pressures and work relations. This stressor is a result of juggling competing priorities and was mentioned by 66% of participants. The fifth major stressor, adhering to regulations and standards, refers to the challenges in following and observing organizational policies, guidelines, and standards amidst contextual limitations while simultaneously addressing collective agreements to facilitate the quality of work life for staff. Challenges related to following policies, guidelines, and standards include patient safety standards, quality improvement initiatives, and collective agreements. This stressor was mentioned by 97% of participants. The sixth and last major stressor, putting out fires, is defined as the responsibility and authority of the manager to respond swiftly to urgent staff, patient, family, and administrative problems at the unit level to ensure smooth day-to-day operations for safe, quality patient care. This stressor was mentioned by 31% of participants. A total of 4 coping strategies were identified. They include planful problem solving, reframing the situation, positive reappraisal, and seeking social support. The first coping strategy, planful problem solving, is a proactive approach to problem-solving tasks and interactions with staff by being visible on the unit and building and supporting relationships as a way to lessen stressor impact. It involves being aware. This coping strategy was mentioned by 91% of participants. The second coping strategy, reframing stressful situations, is defined as the psychological process used as a way to decrease anxiety, minimize stress, and simultaneously make sense of challenging situations. Participants decreased their anxiety and fear by reflecting, reorienting, and reconciling. This coping strategy was mentioned by 75% of participants. The third coping strategy, positive reappraisal, refers to the participants acknowledging and unleashing their emotions in order to process what they were feeling. This served as a mechanism to explore the nature of the stress encounter and how this may have led to stress-related growth while increasing their resiliency. Participants maintained energy and momentum in their role by distancing oneself and unleashing emotions. This coping strategy was mentioned by 88% of participants. The fourth coping mechanism, social support, includes recognizing and accepting psychological and spiritual support in order to find new meanings and directions in complex and challenging work environments. Participants recognize the importance of support from superiors and colleagues. 94% of participants mentioned this coping strategy. Moving forward, a total of 5 recommended actions were identified as a result of the study. These include enhancing organizational support, considering rescoping the nurse manager role, the need for leadership development interventions, evidence-based stress management interventions, and lastly, replace influence leaders with relations-oriented leadership behaviors. The first recommended action includes enhancing organizational support by decreasing administrative duties and administering appropriate supervision practices, bridging gaps across organizational hierarchy with healthcare leader forums, and increase empowering behavior practices to increase staff engagement and support graduate nurses. Another recommended action includes considering rescoping the nurse manager role to decrease workload by using knowledge to manage change and strategically plan for change, as well as adopting a co-manager model with a patient focus. The need for leadership development interventions is another recommendation. This can be done through leadership training that enhances leadership approaches, competencies and skills, mentoring programs for succession planning, and leadership development programs that customizes manager needs. Another recommended action of evidence-based stress management interventions includes adaptive coping through creative alternative coping strategies, the use of emotion approach coping, which includes taking time to determine what one is feeling and expressing, as well as coping through working as a team. The last recommended action, replace influence leaders with relations-oriented leadership behaviors, involves fostering a collaborative leadership style and open communication to build trust. We want to hear from you. Is there any additional information you would like to see from this study? Would you be willing to attend an information session from the results of this study? Is there anything that you would like to see offered in a forum or a workshop? Contact us via telephone or email as listed below. Thank you for your interest and hope to chat soon.